can be sharing that out to the network who receives our emails with resources from our Monday calls. So Sam, thanks again for joining us.
Of course. Yeah. Thank you guys for having me. Can you hear me okay? Thumbs up. Yeah. Okay, cool. So my name's Samantha Saycich. I'm an epidemiologist with the Epidemiology and Scientific Support Bureau with Communicable Disease Epidemiology with Montana's Department of Public Health and Human Services. So I am the viral respiratory epidemiologist. So I do COVID, flu, RSV, and then all the acute respiratory infections. So human metapneumovirus, parainfluenza, stuff like that. And so we do have a section here, the healthcare associated infections and infection prevention and control section that they help investigate cases and outbreaks of these conditions in healthcare settings. So I kind of take all the other settings, whether it's general congregate living facilities like, group homes or daycares or things like that, or just cases in the community I help with. So I also am presenting at Confluence Monday, April 1st at 3 p.m. on kind of on these dashboards, but my presentation's on how to make data engaging. And it'll discuss best practices for, when you are trying to build something like a dashboard, key things to focus on, and then just kind of the success we've experienced with the dashboard so far. So I attended a couple weeks ago and showed the influenza dashboard. So this week we're going to focus on the Pan-Respiratory Dashboard, but these dashboards took the place of a 12-page report that we would publish weekly. Reports are super useful. They're great. But I think when you're considering the broader scope of, who's trying to access this data, a lot of folks trying to access this data are members of the general public. So they don't have that robust epi background experience that we do as we're writing these reports. So, we found the reports were helpful for clinicians and researchers, but we had a very low engagement rate with it. I think we averaged about 100 clicks a week on the report, which is pretty crazy when you consider the size of Montana and our population. So about 100 people were looking at the report a week. And so my goal was, especially after COVID, there was a big push to make data more accessible, and, more people just wanted to see data. So this was kind of my goal with the project, is to get this information out there so Montanans could make informed decisions about their own health. So I will stop my video because I think that makes it lag a little bit. And then I will share my screen and walk you guys through the dashboard. Okay, so Chris has shared the link in the chat for this Pan-Respiratory Dashboard. Can also include that influenza dashboard link, but I used Tableau software to build this dashboard, and I wanted it to be informative and interactive and, simple for people with various backgrounds to understand what surveillance in Montana looks like. So one thing I learned through COVID was that, being transparent about where we get our data, how we get our data, how frequently we're accessing it really does help prevent confusion when people are looking at, reports and things like this dashboard. So the first page just has a little about section with, administrative rules that require these conditions to be reported, where we're getting the data from, so our state surveillance system, and then our syndromic surveillance system. And then, just, making it very clear that this data is preliminary. And then I did want to just compare the 4 big conditions, just so that way if someone from the general public's looking at this, they can kind of gauge what they may be dealing with. So then we go to a season to date summary. So COVID and flu are individually reportable conditions in Montana. This is established in Administrative Rule 37.114.203. RSV is not individually reportable, but under that rule, we have a provision that says any outbreak of a communicable disease is reportable, and that's where RSV comes in. So we track outbreaks of RSV, and then this year we have been asking providers to voluntarily report deaths in children under the age of 5. We have not had any, thankfully. So I publish this dashboard weekly on Fridays. So you can see I just updated it on 3/22, so that most recent Friday, and it has data through the week prior, so March 16th. So our COVID data primarily comes from our infectious disease information system. Local investigators are required to put in each case individually into MIDAS. So we really do have great data for COVID, and then flu hospitalizations and deaths. We have locals just report the total number of cases. They don't have to go one by one and make a case in MIDAS, but they do unfortunately have to do that for COVID still. So there are 14,411 individual cases of COVID in MIDAS since October 1st of 2023. So it can be a little laborious for our local health departments. So we're always trying to think of ways that we can, ease that. But so this page is just a general summary of COVID, flu, RSV, and then we have our outbreaks in all settings. So if you hover over it, a tooltip comes up and shows you that in total, we had 33 active outbreaks, and then outbreaks by condition. And yeah, and then we just define down here kind of what it all means. And so then working with our HAI and ICP section, we identified that there really is a need to distribute outbreak data in healthcare settings broadly, so that way facilities can kind of make specific recommendations for prevention measures or control measures. So this tab shows, some of the facilities we get them from, what state health care facilities include, current outbreaks, new outbreaks, season to date reported outbreaks, and then, yeah, just the administrative rules requiring these to be reported. And same thing when you hover over, it'll show you 20 COVID, 1 flu, 1 RSV, and then we have no acute respiratory illness outbreaks. And then we have a similar page for our outbreaks in non-healthcare settings, which it's interesting to see the difference between the two. As many of you guys probably know, there's the outbreak requirements for healthcare facilities are sometimes a little more strict. Depending on the facility type, 1 case of COVID can initiate outbreak response. So it's not that strict in the non-healthcare settings. We want to see sustained transmission within a facility. So we tend to see outbreaks classified more as acute respiratory illness outbreaks, either because folks aren't testing or they're testing and just not sharing, what they were diagnosed with. A lot of this data is coming from daycares and schools. So, we don't get a lot of specific data on what folks are infected with, but sometimes we do when we get lucky. And then we pull this data from Essence. So we use this to track data for syndromic surveillance. So this is based on outpatient emergency department visits. So folks will go and they'll say, I'm going to the emergency department for COVID, and then they're grouped in, into Essence like that. And it's based off of ICD-10 codes. So we broke it down by week just to see, you can see we spiked here the last week of December in percentage of all ED visits due to respiratory illness. And we have since been trending downwards. And then, this is just kind of a graph showing similar. So number of emergency departments for the condition. And you can see flu hit us pretty hard this year. So then we have just a COVID summary. These are the previous 2 seasons, so 2021, 2022, 2022, 2023. I have the axes synced on these just so you can really see how much we went down this last season. This axis is not synced up because if it were, it would look like this and it just wouldn't be a good way to visualize the data. So I did keep this season a little more narrow so that way we can see the data. And then, yeah, we have cases, hospitalizations, and deaths. So you can see trend over time. Again, late December, we tend to peak with respiratory activity. So we do sequence for variants for COVID at our state public health lab, but we don't get a ton of specimens that come in. So we decided to just show region 8 variant sequencing data. It's a bigger denominator, so we think it's more representative of what's actually circulating in our community. We were worried that the small number of samples that we're actually doing in our state public health lab would maybe result in conclusions that are misleading slightly. So we just wanted to be diligent about that. And then similar to COVID, we have a flu summary. For more in-depth flu surveillance and analysis, I recommend checking out the flu dashboard. We go really into detail, like with laboratory surveillance. This is my favorite tab because it's really satisfying. But yeah, this one just shows basic cases, hospitalizations, and deaths. And then RSV, we do have voluntary sentinel laboratories that are reporting to us the total number of tests they perform for RSV, and then how many of those are positive. So we define RSV season as active when we've had 2 consecutive weeks where we have a positivity rate above 3%. So we've been in that now for quite a few weeks, as you can see. We crossed it back here. And then this is just a comparison of previous respiratory seasons. And then we just have some additional resources for folks. So that way it's easy for them to just kind of visit this. And then if they do need any other resources, they can access it here, or they can go onto our Pan-Respiratory page and get additional information there. But that's kind of the nitty gritty with the Pan-Respiratory Dashboard. If anybody has any feedback or questions or anything in the nature, yeah, I'm always receptive to hearing it.